Welcome to the Authority File. I'm Bill Mickey, your host and the editorial director at Choice. As we enter the winter months of 2020, COVID-19 infections and deaths continue to rise. The containment response here in the States and across the globe, such as it was, clearly hasn't worked as well as we hoped. And as we approach the long-awaited arrival of the vaccine, any progress we've managed to make in containing the virus has actually reversed itself. We're in for a rough winter. Along the way, as researchers track the data related to the spread of COVID-19, they've come to a new understanding of how policies, legal systems, and governance have responded to the virus and how these have exposed vulnerabilities in our infrastructure, institutions, and most importantly, people who are most susceptible to the virus and more likely to die from it. In fact, the manner in which many countries implemented their COVID-19 responses actually exacerbated vulnerabilities in certain populations. My guests for the next 4 episodes have compiled a volume that explores one country's response to COVID-19, Canada's. It's written primarily from a legal perspective, but grounded in governance, accountability, civil liberties, equity, labor, and global health. The book is called Vulnerable: The Law, Policy, and Ethics of COVID-19, published by University of Ottawa Press, the sponsor of this series. While the title focuses on Canada's response to COVID-19, it includes a global perspective on the ways in which governments can and should prioritize their policies in responding to and recovering from a pandemic. It pulls together experts in law, ethics, philosophy, public health, and medicine. Joining me are the book's editors. Colleen Flood is the University of Ottawa Research Chair in Health Law and Policy and inaugural director of the Ottawa Centre for Health Law, Policy, and Ethics. Vanessa McDonald is Associate Professor at the University of Ottawa Faculty of Law and co-director of the U Ottawa Public Law Centre. The Honorable Jane Philpott, who is Professor of Family Medicine, Dean of the Faculty of Health Sciences, and Director of the School of Medicine at Queen's University in Kingston, Ontario, and served as Canada's Minister of Health from 2015 to 2017, and then Minister of Indigenous Services from 2017 to 2019. Sophie Theriault is full professor and vice dean in the Faculty of Law at the University of Ottawa, and Sridhar Venkatapuram, who is an academic practitioner in global health ethics and justice. Sridhar is associate professor at King's College London and director of global health education and training at the King's Global Health Institute. Since we were fortunate enough to speak with the whole team of editors for this series, we're dividing the group among the next 4 episodes. In the first 2 episodes, we'll hear from Colleen Flood and Vanessa McDonald, who examine the pandemic response from governmental and legal perspectives. In episodes 3 and 4, we'll be joined by Jane, Sophie, and Sridhar, who will address issues of equity and vulnerability. So, joining me now are Colleen and Vanessa. All right, Colleen and Vanessa, welcome to the program.
Thank you.
All right. Vanessa, so looking at the Canadian response to the coronavirus pandemic from our perspective here in the U.S., it looks enviously swift and effective, but the speed of the initial response meant there wasn't time for public discussion and comment on many of the measures implemented. I'm wondering if you could talk about that and what was lost because of the rapid quote, unanimous consent approval process that most of the response bills went through in the Canadian Parliament.
Right. So in the initial weeks of the pandemic, the federal government put forward a number of pieces of legislation. Many of them actually dealt with the economic sort of fallout of the pandemic. So putting in place emergency programs for individuals who had lost their income or that type of thing. And many of these, most of these, if not all of them actually, these pieces of legislation, when they were put forward, what had happened was all of these packages of legislation were negotiated in advance. And some of that, of course, was the product of the fact that right now Canada federally has a minority government. But the government had negotiated with the other parties, essentially behind closed doors, about the contents that package. And so when the legislation was presented in Parliament, what you had was essentially a pro forma legislative process where with some of the legislation there was really no debate at all in either of the chambers. With some of the pieces of legislation there was a little bit of time allocated for questions in committee, for example. But I guess the idea is here. There's really a trade-off, right? On the one hand, in an emergency, in a pandemic, of course, we not only hope but expect that our governments will move swiftly, and so
Mhm.
um, speed really is important when you look at the sort of scale of the economic fallout. It was very considerable, impacting most Canadians. So of course there was a need to move very efficiently, but sometimes when you have a piece of legislation that is, essentially negotiated behind closed doors, it's then introduced in Parliament and it's passed through a pro forma process. You really lose any opportunity to have a public discussion about the choices that the government has made.
Mhm.
So, um, while that, one of the critiques that has come up about the federal response to the pandemic has been, of course, in the early days, you do expect government to work quickly. And, it was clear that in those behind the scenes negotiations that the opposition parties did secure some changes to the legislation. They were effective in some ways, I think, at keeping the government accountable behind closed doors, but that's obviously not ideal in a democratic system. And certainly one of the critiques that we've heard is that long after we moved out of that immediate period where there was a need for sort of that immediate response, long after that period had passed, we still saw the government using this unanimous consent procedure. And so what's lost is essentially an opportunity to debate publicly the wisdom of these measures, to have the government present its rationale and have that rationale tested. Um, so, I think it's also important not to glorify the normal legislative process too much, right? There's always some extent to which, it's always true to some extent that pieces of legislation are largely, prepared in advance. Once they are introduced in Parliament, it's unusual to see a bill completely reshaped by
Yeah.
legislative process. Of course, there's going to be something between that extreme and what we saw, which was really very little by way of public debate about those measures.
So was there a reason the unanimous consent process was maintained? I mean, was it simply because they needed to continue moving quickly in passing new legislation, or did that excuse kind of lose its power along the way, and maybe perhaps the unanimous consent was maintained for other reasons, maybe just purely efficiency sake, or
Well, I think I think it was, at the beginning, the way the government was proceeding. And
mm,
as time goes on, it's not clear to me that whatever urgency was felt in those first days and weeks was still present. And so my sense
mm,
was I mean, certainly that's an easier way to govern
yeah,
because it really is a way of governing where you face much less opposition. I mean, I should
hmm,
also say in the early days of the pandemic, the federal government was quite involved. And I think it's fair to say that in those early days, it felt like the federal government was really leading on some of the early initiatives. The other thing that's happened as the pandemic has unfolded is because of our federal system, the provinces have, they are responsible for healthcare. They're responsible for local measures, and so we've actually seen, the provinces take over as the primary level of government responsible for the pandemic response. And so part of what's also happened is, once those initial um, economic measures were in place to assist people who had lost their employment because of the pandemic, once that initial period passed, we've seen the federal government really, or the provincial government, playing the more important role. So I think some of what we've seen is also just a sort of shift to the more local level of government in terms
Mm-hmm.
of the pandemic response. But my impression is I don't see a continued need for those abbreviated processes. And my
Yeah.
guess is that it's just convenient if you can keep going using those procedures. But there's no question that yeah, they do come at a cost.
Yeah. Okay, excellent. Colleen, in chapter 6 of the book's first section, which you co-wrote, you kind of stress test, so to speak, the effectiveness of Canada's Emergencies Act with several different pandemic-related scenarios.
Mhm.
A countrywide lockdown, comprehensive testing, and protecting long-term care homes. I'm wondering if you could quickly give us a background on what the Emergencies Act is and what it covers. And then as you ran through these scenarios, where did you find the Emergencies Act to be um, either ineffective or otherwise structurally unable to address the unique aspects of this pandemic?
So the Emergencies Act, Canada's Emergencies Act, is limited in a
Mm,
number of ways. It was passed in the wake of World War II and various measures that were taken to intern Japanese Canadians. And so as a result, there are a lot of strictures and means within the Act to prevent the federal government from taking steps too far. And that's all fine. However, it's clearly not fit for purpose in the context of a pandemic.
right.
It's meant to work for public health as well as for other kinds of emergencies. But if we're, for example, thinking about the perhaps a lockdown, a national lockdown. At this point, we're probably not thinking along those lines. But initially,
Mm,
many countries did do that. They called for and did implement either a national emergency or had a national lockdown. And it is interesting, I think, that Canada is alone amongst federated, developed countries not to do one or the other. And so I think this does speak to the limitations of the Emergencies Act. And, things like implementing contact tracing, putting in place national measures for long term care, something like a lockdown, all of these things we sort of tested and found that there might be problems with the federal government trying to do that through the Emergencies Act. Not to say that it could try, but there might be some pushback. Um, so sorry, you were going to ask me a
Yeah, I
question.
was just going to say, where would that pushback come from?
So the different provinces may rail against the federal government taking steps in
Yeah,
what they perceive to be their jurisdiction.
right.
But clearly, the federal government does have the power to act in time of emergencies. That's within its domain. And it doesn't have to rely only on this particular piece of legislation. So the Emergencies Act is on the books, but it could be that the federal government enacted new legislation to permit it to act, or amended the Emergencies Powers Act to enable it to act right now. So it does have some options. But as Vanessa just mentioned, what we're tending to see is the federal government in Canada, as we're seeing the second wave, collecting its victims and increasing rates of infection and death, saying, well, look, this is, we are just supporting the provinces in whatever they choose to do,
Hmm.
rather than saying, we need to have some clear standards here, some best practices that all provinces should be following. And then, if those provinces aren't doing that, then considering at least taking some kind of national action. But at the moment, they're not doing anything remotely like that. And I think that's probably not a good thing myself.
And why is that?
Well, as I mentioned, we have in the second wave, we have increasing rate of infections and increasing death toll.
Mm-hmm.
And it's clear, for example, that despite all the lessons we should have learned from the first outbreak, the first wave, about what we should be doing in long-term care homes,
Yep.
that hasn't happened, or at least it hasn't happened sufficiently.
Mm-hmm.
So we're still seeing terrible outbreaks in long-term care homes in the second wave. And it seems likely that with the onset of winter and everybody moving indoors, and now we're really going to see how, ventilation systems are working in long-term care homes and schools and so forth and so on, that we are, we've got a real crisis on our hands again. And we had all of this last year to get ourselves ready for this, and we don't seem to be. So it does, in my view, it does seem from a public health perspective that we need better and clearer measures from coast to coast about what should be the best practices, rather than devolving it down to provincial and local levels, which is currently what's happening.
Mm-hmm. Can I ask, so for using the example of the long-term care homes and sort of the lessons that were not learned,
Mm-hmm.
Here in the States, obviously the whole pandemic has been so politicized, and
Yeah.
which has been hugely problematic for any kind of national effort. But
Yeah.
is that what's going on in Canada as well, in the provinces, or is it more just of a sort of a operational and procedural approach that's just not working?
It doesn't seem that it's been particularly politicized.
Yeah. Okay.
The large provinces that are in trouble, Ontario and Quebec, are run by conservative governments at the present time. But we also have British Columbia, which is run by the NDP, so a more left-leaning government, and they are also starting to struggle again. They were sort of the poster child at first, but they're seeing numbers go up and so forth. So there's not a sense of politicization. Perhaps there should be, because the federal government is simply saying, look, we're just here to support the provinces and we're not going to critique them. We're just, we may raise today, Justin Trudeau said, I'll raise my voice with others to sort of encourage, stronger measures, as if he's just one of many, just an ordinary person. So I don't see it politicized in the same way as it is in the United States.
Right.
That doesn't mean that there isn't politics going on, for sure.
True. Right.
Particularly in the choices that are being made at the provincial level about whether to take more measures, or, we want to keep our small businesses going, our economy, our quote unquote economy going. And so we're not taking perhaps the precautions that we should be, because we want to keep those interests happy.
Okay.
Yeah.
Excellent. So Vanessa, your chapter called Ensuring Executive and Legislative Accountability in a Pandemic points out that, quote, there is no guarantee that majoritarian political processes will be effective in addressing the disparate impact of lockdown policies on vulnerable groups. What might be useful policy mechanisms in Canada for addressing the needs of vulnerable groups other than, quote, majoritarian political processes?
Problem that always exists in a majoritarian political process, which is that decisions tend to be made with the majority in mind, and not necessarily the minority, or not necessarily with the interests of groups who are disenfranchised from the political system in various ways in mind. And so I think we've seen at the level of public health policy, especially locally, especially at the municipal and the provincial level, we've seen provinces adopting different public health policies that, to my mind, some of those local policies do really take vulnerable groups into account, and whereas others don't. So I'll just give you one example. So just today, the province of British Columbia, or it was just yesterday, I guess, announced a provincial masking mandate. And so you can now be fined in the province of British Columbia if you don't wear a mask. And I saw on social media last night people expressing surprise that it took the province of British Columbia so long to implement a mandatory masking mandate. But what you had the now famous Dr. Bonnie Henry saying in British Columbia was the reason for not imposing a masking order across the province until the numbers got very high was that the motivation was a recognition of people's differential ability to access masks, to wear masks, that once you have a masking order that's backed with a fine system, that we know that often vulnerable individuals will be disproportionately the subject of those types of fines. And so I think you're seeing local public health officials adopting pretty sophisticated approaches to the pandemic. And some of those involve, some of that involves not using the coercive powers that those officials have, right? So it involves trying to encourage the public to follow good public health practices without actually going so far as to implement, make a practice mandatory and back it with fines. Now, of course, we see in British Columbia, in other provinces, as the numbers are again climbing, Canada is probably at the height right now of its second wave. And I think, our self-perception for a long time was we handled the first wave pretty well, but things are not going well. At the present time in Canada, you're seeing public health officials pivoting toward more coercive measures. So I think when we see those sort of voluntary measures, or where you see those softer measures, that's really intended to acknowledge the ways that mandatory orders can have a disproportionate impact. But certainly, this is one of the stories of the book that we wrote, and we wrote this as a collective at a very early stage in the pandemic, and we identified the equity issues as being very significant. And I think that story has really been borne out. That's one of the aspects of the book that, unfortunately, I think, our concerns that we expressed in a sort of preliminary way back in May have really been borne out. That this pandemic has really hit vulnerable people much harder than it has people who are less vulnerable. And so, but yeah, good public health officials, I think they take that into account, and that's been very much driving their response. Yeah.
Okay. Yeah, because I was going to ask you both actually, if it is actually possible, to marry compliance and sort of civil liberties, or in situations like the one we're in now, how can a country convince its citizens to temporarily suspend certain liberties? And then how do you factor in, how do civil rights factor into that? Colleen, I'll just kind of jump over to you on that one.
Sure. So the first thing I think is that, when we talk about civil liberties or civil rights, we might talk about them in kind of common parlance, like I have a right not to wear a mask, or I have a right to, ride on the bus without a mask, and these kinds of things. But that doesn't necessarily translate over to having a legal right So we have to keep that in mind. There's sort of distinction, I think, between actually having a civil liberty that transforms into a constitutional right, as opposed to just, a general sense that you shouldn't mess around with me. You're the government and this is where my space is around me, and don't come in my space.
Right.
So there's a difference there. But your point is, I think, less a legal one and more a soft question of how do we, how do you persuade the populace to kind of come along with you?
Mm-hmm.
And I think, the evidence is pretty clear on that, that you're transparent, you're open, you provide the evidence, you're empathetic. So Bonnie Henry, who's a public health official in BC that Vanessa just mentioned, she's in part quite famous because she has kind of captured all those qualities. And when she speaks to the public, she's very clear and transparent, open and empathetic. Jacinda Ardern, and Prime Minister of New Zealand, has been doing similar things to great effect. So, that's how you bring people along with you. And, you're honest and open, and you admit if you made a mistake, and that's the way you do it.
Right.
I think we have a problem here in Canada right now, and I think it's the same in the United States. So Vanessa was mentioning the benefit of local folks calibrating measures, but the downside of that is that we have such a mess of measures all over from province to province, from locality to locality,
right?
Combined with what they're calling pandemic fatigue and winter coming on, that I think we have a real problem with communication right now. And this just feeds all the sort of conspiracy theorists, blah blah blah.
Yeah.
That if two public health officials can't seem to agree on the same measure, if you've got Theresa Tam, the Chief Medical Officer of Health of Canada, saying one thing, Vera Etches, the local public health officer for the for Ottawa, saying another thing, and then yet another thing being said by Bonnie Henry out in UBC. Well, you can forgive the kind of common person for thinking they're all batshit, right?
Yeah, right.
Because it's just too complicated, and I think they're starting to lose goodwill with this. And so, this complicated federation that we live in, one of the big things we have to figure out from here is, how can we get clearer and better communication with the public to persuade them of the need for precautionary measures? And how can we, like in many places we're trying to, quote unquote, save the economy, let businesses be open, et cetera, at the same time, we're telling people that they can't get together to see their families, right?
Right.
So we want you to go to the restaurant and sit beside somebody and keep the restaurant open, but at the same token, you can't kind of come together for Thanksgiving or something like that.
Right.
So I think, and there may be a justification for that, but it needs to be clearly articulated. Look, we have to make these personal sacrifices to keep these businesses open, and we know this sucks, but this is why we are doing it. I don't think that we've had enough clarity in that. It's just, I think, confusion.
Right.
I'm not sure if I answered your question completely, but the civil liberties issue, when we look at claims in civil liberties, for example, closing borders, in particular, that's where we've seen most of the claims here at the moment. So people wanting to traverse provincial boundaries, and some provinces have closed their borders to others. And so far the courts have upheld that kind of closure. But what we write about in the book is that over time, if there are serious civil rights claims made, that the courts are going to look to the government to say, look, can you achieve your objective, keep COVID out or keep it down without having to breach someone's civil rights or rights mobility. So they're going to be looking to the government to provide them evidence over time.
Right.
And so they're going to need to collect that evidence.
Okay, excellent.
Yeah.
You just heard from Colleen Flood and Vanessa McDonald, co-editors of the book Vulnerable, The Law, Policy, and Ethics of COVID-19, published by the University of Ottawa Press, the sponsor of this series. Join us next week when I continue my conversation with Colleen and Vanessa, addressing aspects of the legal underpinnings of Canada's response to COVID-19. Later in this series, I'll be joined by the rest of the book's editors when we'll discuss issues of equity and vulnerability during the pandemic.
We did forget many of the lessons of SARS, right? And not only that, but we've already forgotten, it would seem, the lessons of the first wave. I mean, many of the things that we were horrified with, these deaths in long-term care homes in the first wave, we are literally seeing all over again. And we are in almost no better position. We have more PPE than we did in March. There's no question about that. But we are still battling horrific outbreaks. And so, part of the problem is that we do have a very short memory. And there is this question of whether, when we get beyond this, are we going to be willing to invest in those public goods in a proactive way that will keep us safe next time? We're just not very good at that longer term thinking.
If you like what you hear, rate us or give us a review on your podcast platform of choice. And if there's a topic you'd like us to cover, drop me a line. I'm at bmickey@ala-choice.org. As always, sponsorship and advertising for the Authority File podcast are handled by Choice's advertising manager, Pam Marino, and all of our episodes are produced by Choice's senior digital media producer, Mark Dirks, and digital media assistant, Sabrina Kofer. That's all for this week. Thanks for joining us.